Hi, I'm Christian with BeWellPBC, the Palm Health Foundation, Healthier Together Communities, and my fellow community connectors recently invited two local physicians, Dr. Michael Smith and Dr. Tiffany McCalla, from the Leroy Jefferson Medical Society to join us for a couch conversation to talk about COVID-19. We appreciate the doctors giving us straight talk about COVID-19 and how we can all stay safe. This is the first in a series of 4 videos discussing what you need to know about COVID-19. In this video, you will learn what you need to know about COVID-19 in Palm Beach County. Get ready to learn about COVID-19 and be sure to watch the other videos in this series. You can find the series on BeWellPBC's or Palm Health's YouTube channel.
What is the state of COVID right now in Palm Beach, in our Palm Beach County communities?
The number of cases and deaths have actually been going up and down over the months, but we've started to see a slight trend in the number of cases and deaths that have dropped a little bit. In terms of, age distribution, most of the cases of COVID-19 are between the ages of 15 and 64, with the most number of cases between those who are 25 and 34. Right now, the latest ticker for Palm Beach County is 1 million, well, for Florida, 1,921,548. And hospitalizations at 81,000 and deaths at 31,948. So we really, all of those are numbers that sometimes those numbers mean something to people who are more familiar with them. But the short answer really is that we are not out of the woods yet. It's very scary for me and disheartening for me when I see people in the streets, particularly on the weekends, dining at restaurants wearing no mask, as though the pandemic is over. I understand the fatigue. I've been on several panel discussions about pandemic fatigue, but it's really important to stress to you that no matter how tired of the pandemic you may be, the virus is never tired of you. And the virus is always looking for a host. So we are in a much better place now. We've had the vaccines from Pfizer and Moderna out for about a couple of months now. But unfortunately, folks who are not really familiar with the science, and particularly the science of public health, they think that, or they behave in such that, oh, well, the vaccine is out, now I can return to normal life. That couldn't be further from the truth. The vaccines just came out, folks. The vaccines just came out. Even if you are fully vaccinated, I disagree with the CDC putting out the recommendations to visit family members or visit neighbors next door if you've been fully vaccinated. It is too soon. We still don't know about the transmissibility. We don't know if the vaccine provide protection against transmission. So, and I think they are yielding to societal pressure or even politics by releasing such a statement. It's too early for that. We just don't know yet. And I tend to, whenever I'm dealing with, issues on the health of the public, I always err on the side of caution. Like I said, the vaccines just came out. We still need to continue to mask. We need to continue to social distance. We need to continue to wash our hands as soon as we get back in from being out in the public. And if you are out in the public throughout the day, you need to constantly wash your hands every chance you get. In my sense, we need to see more. We're not in a place yet where enough of the population has been vaccinated before we can just start trying to get back to normal. My feeling is that if we can get enough of the population vaccinated by the end of the summer, perhaps by the end of July, we're going to be in a much better place. But that all depends on society. Anyone who studies public health history knows that any pandemic or epidemic is based on the behavior of society, how people respond to it. Now, over the centuries, centuries, man has responded to those who understood when a plague came into the village or came into the town. People tend to respond, they listen to whatever type of scientists they had at that time. Unfortunately, over the past few years, with the intervention of politicians who frankly don't know what they're talking about, people have lost confidence in science and have been doing their own thing and yielding to pseudoscience. The fact of the matter is, you need to listen to the science. If we can get society to comply with the behaviors of social distancing, masking, getting their vaccinations, we're going to be in a much better place by the end of the summer. As I've told colleagues at the College of Medicine, based on the current trajectory, and if we can get society to continue in the direction of everyone getting their vaccinations as quickly as possible, I believe that we will be at the beginning stages of returning to some sense of normalcy by late December. That is what I see right now. Now, of course, that can change if society decides to not comply. But I think with Johnson & Johnson one-shot vaccine coming online, I think that we're going to see a tremendous change in the prevalence of cases and a downward change in the number of deaths associated with COVID-19.
The biggest thing that I can say is that during this time period, because I have been practicing so long, similar to what Dr. Smith was saying, I've seen several pandemics. I worked during H1N1. I worked during the first SARS. I was actively taking care of patients during MARS. We had measles outbreaks in New York City. And I can 100% on the clinical aspect attest to what he is saying, which is the public makes the difference. We really do. So it's really all of us, because if we do the right thing, we are able to continue this downward trend that we're seeing now. And if we're not able to do that, unfortunately, we give the virus additional room to spread. So if you want to think of each person almost like a potential vector. So if you have a room full of 100 people, I know there have been so many models out now that I'm sure many people have seen it, but if you haven't, try to imagine what I'm saying now. So just a room full of 100 different dots, almost like a checkerboard or something. And you have one dot that is infected. And if that one dot jumps to the next dot, so that every dot around it then technically becomes infected, right? And if you wait a couple of days and every dot around the outside rim becomes infected, and it goes on like that. But let's change the dynamic. Let's change the story. If that center dot that's infected, if every dot around that center dot is vaccinated, then they don't get the infection, right? So they will be exposed, but they have been vaccinated, meaning that they will develop an immune response and be able to knock that virus down so it doesn't kind of take hold of their body. So then theoretically, they're not spreading it, especially not as long, to the next rim around that circle. I hope that people can see what I'm trying to say in their minds. What Dr. Smith was speaking to is that because this vaccine is so new, we're not 100% sure about how long it'll take for the person who has been vaccinated to then develop this amazing immune response and knock the virus down. So how long they have that active virus that they could potentially spread to the next ring. Does that make sense? I hope it does. If it doesn't, feel free to ask questions. But this is the issue that we're facing, and this is the concern. And this is why when people talk about native immunity and host immunity, why we get so tricky, and so why so many different people feel so differently about it and so strongly. Of course, everybody wanted to believe that once you got COVID, you would never get it again. And once you got COVID, you would get that herd immunity. But the virus is tricky, because that's how viruses survive. At the end of the day, everything wants to survive, us as humans, and the virus wants to also. So when the virus sees that now you have a little bit of immunity to, COVID from January of 2020 or January of 2019, then, now that virus is going to switch a little bit, just enough so that you no longer have quite the same level of immunity. So now you're reinfected. Is your second infection going to be like your first infection? Who knows? It's still a relatively new virus, but I can tell you from my clinical perspective, people getting the second infection, to my surprise, sometimes get sicker than they did with the first infection. And we just have no way of knowing who's going to be sick and not sick. So that's my start, and I'm going to back off, and I'm here to answer any questions. But just we stress the importance of vaccination. We stress the importance of keeping clean, washing your hands, keeping covered, wearing a mask, keeping clear, staying away from people. So not being the people around that center person.
Right.
About considering the vaccine if you're offered, considering monoclonal antibody if you're infected, right? And continue testing. These are the C's that we have talked about with Leroy Jefferson Medical Society, which is, the organization that both Dr. Smith and myself are, very intimately involved with. The reality is this information is not just for us, and it's not just for you that are on this call. We hope that you spread it so we keep everyone safe.
But in terms of the impact of the pandemic, it's been having a profound effect on all of us. What I've said to people is that as adults, we all know, we all talk about our problems, and some adults have lost their jobs because of the pandemic, lost all kinds of things. It's been really tough. And that's why I thank God every day for my blessings during this pandemic. But there are members of our community really, really suffering. I mean, it is, when I think about it, it is heartbreaking when a person they kicked out of their apartment because they can't pay the bills anymore, or when they're struggling trying to get any kind of job just to pay the bills. I see this in family and friends. And you can only do so much to help people and prop them up as best you can. But it is absolutely heartbreaking. But what I said to people, to adults, is be careful of how much of this burden you put on the children. Your teenagers and young children, they hear you. They hear this stuff. They see mommy, they see daddy, they see whomever stressed out, angry, not as fun as they used to be. Who knows? Maybe mommy's drinking more now, or daddy's drinking more, mommy's not around. I mean, and they see this, and these children, they are helpless, and they feel helpless because they can't do anything about it. And in a child's world, we still don't know what kind of, we know that there is depression among young people and teenagers. We know that some teenagers, because of the social isolation that they've been experiencing with virtual homeschooling, not being able to fraternize with their friends, that there's been a great deal of mental health problems with that. Some young people have resulted to suicide. It is a serious issue. And I just want us adults to be mindful of that and be careful of what you say around your children, and try your best to provide them with some way to alleviate the stress that they are experiencing. Because children, young people, teenagers, they often have a hard time expressing how they feel, trying to interpret, how do I feel? I mean, sometimes we as adults have a hard time expressing how we feel. So you can only imagine a young person, with limited life experience, they don't know how to express what they feel, but they just feel something and it just doesn't feel good. And sometimes that pressure gets really intense at a moment. And we need to be mindful of that. And I gave the young people in this fellowship that I work with for Florida Atlantic, I gave them, some hotline, a phone number for a hotline. And I gave them a number for a text, if they're feeling in crisis, okay? Because sometimes, people with mental depression or so forth, they suffer in silence. And your child could be right in that room next to you and you don't even understand it. You don't even know it. So you have to be vigilant and you go check on your children and try to find ways to get them out of the house, try to find ways to increase, to stimulate, their mental activity and support their ability to communicate with their friends, because as adults, friends don't mean as much to adults as friends mean to kids. That is their world. That is their world. So really make sure that you are paying attention to that. Let's not just get caught up in our adult world and all this stuff. Let's make sure we're taking care of our kids.
And I have another question
All right.
about people who don't have insurance or primary care doctors. Do you all have resources that off the top of your head that would be, beneficial for the audience to know about?
If you develop an active COVID-19 infection, you can call OOO Medical Center, which is owned and run by Dr. Osiami, who's an infectious disease specialist. He has multiple trials that are still going on that you actually will be paid to be a part of. And you can get therapy and treatment for COVID and be monitored for COVID. Outside of that, healthcare district is still the district healthcare services for people that do not have health insurance. Found Care still provides free healthcare screening and healthcare services for people that do not have insurance or primary doctors in Palm Beach County. CareDad does the same. There are multiple smaller organizations that you can contact: the Hispanic Chamber of Commerce, the Hispanic Medical Association, the Indian Medical Association, the Leroy Jefferson, which is a subchapter of the NMA, to get some of these resources. So they are there, and at the end of the day, the emergency department everywhere in the county is a safety net for anyone, whether they have insurance or not.
Does either one of you know what is being done to get the homeless population vaccinated? Is there any special program? Because some of them are, they're homeless because, they maybe want to, and they're not going to seek the vaccination to be vaccinated. So can anybody speak on that?
I don't know of any specific programs, but I do know that the vaccination is not being forced on anyone. So people have to actually want the vaccine and they have to somewhat seek it out. And unfortunately, that means that disenfranchised population, if they don't have access to internet or to television, they may not know where some of these vaccination sites are. But there have been several pop-ups that don't require necessarily appointments, that you can walk up. If you fit the criteria, you're able to be vaccinated. And I do know that a healthcare district has somewhat targeted, certain populations to help them get vaccines. So specifically people that are at higher risk to develop more severe illness, and or people that are in situations that may be unable to get the vaccine themselves. So there are multiple groups. I want to say almost everyone has skin in the game, right? Because this is a respiratory virus. So if all the homeless people don't get vaccinated and they continue to, get sick and spread it, they spread it to everybody, right? So it's not like it's an isolated thing. This isn't just a touching type of disease. So we really are all in this together.
I really appreciate the question because the homeless are always close to my mind whenever something happens in the world beyond the individual's control. I mean, every time, it gets really cold in a certain state, I'm concerned about the homeless. And Dr. McCalla is absolutely correct. We all have skin in this particular game, whether we want to or not. And the homeless population, they are always going to be the last population to receive any kind of treatment, whether it be just traditional healthcare, and of course, they are going to be the last group to receive treatment for this virus. So for those people who live in cities that have a high population of homeless, beware. Okay, places like New Orleans, folks, we love to go to New Orleans, but they have a lot of homeless in New Orleans. Places like San Diego, all right, areas of New York,
Atlanta,
Atlanta,
California.
beware. Well, wherever it is, beware, because if you are not fully protected, sometimes those people can be in proximity and you don't realize it. You are at risk. Your risk may be low, but it's still a risk. So, and that's why we said that, we can't relax, the safety precautions that we've been told to adhere to, for over a year now, just because we have vaccines out. We're not there yet. It is absolutely premature. What the governor in Texas is doing, it is perhaps the epitome of idiocy. What he's doing. It goes against every scientific understanding, in the world. But of course, politicians are different from scientists. They do things for other reasons, sometimes unethical, sometimes whatever. We've just experienced, come out of 4 years of an administration that seemed to have an adversarial relationship with science. So be careful and be cautious, and as as Mr. Hammond said earlier, be smart and protect yourself. But I too don't know of any specific programs for the homeless, but in truth, that is really not surprising. Right now, we're still trying to work out programs to get the general population inoculated. So to think that there's a program for the homeless right now is not realistic. Hopefully there will be. I hope that's on this administration's agenda to provide, mobile vaccination vehicles and so forth for the homeless and give them incentives to get vaccinated, maybe offer them a few dollars to get vaccinated because it benefits all of us for them to be vaccinated. I hope that's part of the plan moving forward.
Thank you for joining us for Let's Talk COVID-19. For more information, please be sure to watch the other videos in this series and visit the Leroy Jefferson Medical Society website.